So our need statement is a way to reduce hospital days in patients with small bowel obstruction who have had prior abdominal surgery. So we've done some preliminary brainstorming and have some prompts, lots of prompts to work with. And we're going to start looking at different embodiments of the solution and just kind of see where that takes us. All right. So what did you say you wanted to start?
So let's maybe start with mechanical, electrical, and there were a couple other.
All right, go for it.
Okay, so do.
Why don't we just spend some time on mechanical first, and then when we hit a wall, then we'll move to.
Oh yeah, it's a good idea.
Okay.
So something that goes through the obstruction and changes the shape of the bowel, like untangles it.
Okay.
Okay.
What about something that's like inside the peritoneum and agitates around and breaks up adhesions?
Okay.
Cool.
Untangles bowel, so that could be from inside. But I suppose it could be
External also.
yeah, and so it's just manipulating it.
Yeah.
Okay. And so breaks adhesions inside.
Yeah.
In other ways, how does it break
This
it?
could be outside though too.
And does it cuts it? It can cut it.
Yeah.
Right.
It could like
Dissolve.
Dissolve. Yeah.
vaporize, heat.
Let's go. So
Cool.
I don't know if it's okay to go back and forth,
Yeah,
but
of
so
course.
untangling. So magnets. Can we
Yeah.
do? You like have
Sure.
two magnetic ends, so there's magnets involved. Is it wire?
Yeah, or maybe like an automatic thing attached to the bed that shakes the massage type of a thing.
Okay. Yeah.
I think that gets to like, could we just do sort of like a physical therapy, like maneuver the patient?
Right, and gravity seems to help patients get better. So if we could kind of replicate that somehow, is move them around or motion.
When we say mechanical, I have a whole other sort of area of idea about sort of things that would go through and just try to, instead of trying to break up the obstruction or untangle the bowel, but sort of just get rid of what's in there. What's in there
So
right
what's
now.
blocking?
So remove the
blockage.
blockage, like
And like we just saw that
like
device with a
roto-rooter,
Lindsay.
Yeah.
Some like algorithm for like spinning around. It's got a gyroscope and it like untangles the bowel
Yeah,
like in the
okay.
path of least resistance.
Okay.
I gotta write that up there.
Yeah. Gyroscope and movement that it can manipulate the bowel from the inside. And this could have algorithms that automatically do it, or it could be remotely controlled.
Like Roomba,
Right.
something like that.
Yeah, like Roomba, exactly.
Bowel Roomba.
Okay.
Bowel Roomba.
You want to try another prompt?
Yeah, let's try a different prompt.
Okay, a totally different. Great. So.
And move to another wall. So
Oh, we were gonna do electric.
You want to? Okay, let's go there.
Okay, this was mechanical. All right, electrical.
The side. Okay. So what falls under electrical?
I'm shocked. So the bowel movement is peristalsis.
Oh,
so
yeah.
all of that
stimulating
nerve. So
that bowel movement.
Yeah, shock is
yeah.
good. It to activate the bowel, which is kind of sleeping.
The process of brainstorming is, well, I think to be most effective, it's a very high energy activity where everyone is participating, and the ideas come very rapidly, and you can really build off each other and build off each other's energy. And so when the energy starts to sag and you start to lose momentum, then sometimes changing directions sort of renews that vigor. And then a lot of times you'll find that you'll come back to something where you got stuck earlier. But I think it's important to just keep the energy, keep the flow going.
The first brainstorming session we did, it ended not because we were out of ideas, but just because we were out of time. But that was fine. It gave us all a chance to kind of work with the ideas that we had come up with. Next time we came together, people said, "Oh, here's something else I had," and I was able to sort of get us jump started on that next phase.